Welcome, everyone, and thanks for joining us on this Saturday. This webinar is the first of 3 webinars in a series titled Mass Incarceration in the Pandemic, hosted by the UCLA Center for Social Medicine. Today's session has been jointly organized with the UCLA Law COVID-19 Behind Bars data project and is titled, Can the Courts Fix the Crisis of Prison Health? We have a very exciting lineup of speakers that I will tell you more about in just a moment. I also wanted to tell you about our upcoming webinars in this series. Our second webinar is entitled Healthcare Inside and Out, and that'll be Saturday, May 8th, also at 10 a.m. Pacific time. And we'll have clinicians and policymakers addressing the urgent clinical questions that have emerged in the wake of the pandemic. Our third and final webinar will be on Saturday, June 12th, and is provisionally titled From Toxic Infrastructure to What Infrastructure? We'll dive into current actions at the LA County level and visions of how to transform the system, including the Board of Supervisors Alternatives to Incarceration Initiative, Proposition J, and the Gascon reforms. But now for today's exciting session. Over the past 13 months, since the onset of the COVID-19 pandemic, why have the US federal courts not taken more decisive action in cases brought on behalf of people behind bars? As of April 2021, over 40% of people incarcerated in California prisons have tested positive for COVID-19, and at least 216 people have died from it. The unrelenting surge of COVID-19 infections and deaths in prisons has proceeded without any significant or effective resistance from state or federal courts. This surge is driven by the inherent risks of respiratory illness in prisons and the persistent overcrowding and constitutionally inadequate medical and mental health care available to prisoners in California. What might the federal courts have done, and what changes are needed to resolve this crisis, prevent future crises, and to reduce the toxicity of mass incarceration more broadly? To discuss these questions today, we have a terrific lineup of 4 speakers. We're posting longer versions of their biographies in the chat, but I'd like to introduce them briefly now. Our moderator, Sharon Dalovich, is the director of the UCLA Law COVID-19 Behind Bars data project. She's also professor of law at the UCLA School of Law and the director of the UCLA Prison Law and Policy Program. Hadar Aviram is the Thomas Miller Professor at UC Hastings College of the Law and a leading scholar and advocate against mass incarceration in California and nationwide. Last October, she brought a San Quentin COVID-related habeas case in Ray von Steyck to the California First District Court of Appeal. Jane Dorotik is a registered nurse and healthcare professional who was incarcerated for 20 years on a wrongful conviction and was recently exonerated thanks to the amazing work of Loyola Law School Project for the Innocent. She's a member of the California Coalition for Women Prisoners, a current member of the Board of Directors of Californians United for Responsible Budget, and a former board member of Justice Now. James King is a writer, organizer, and campaign manager for the Ella Baker Center for Human Rights. He has written numerous op-eds over the past couple years and a weekly blog that gave a first-person perspective of the true impact of mass criminalization and living within the prison industrial complex. In 2016, he organized a symposium at San Quentin where he and other incarcerated students made specific policy recommendations concerning the implementation of Proposition 57. Before turning it over to Sharon Dalovich, I want to encourage everyone in the audience to submit your questions via the Zoom Q&A function at the bottom center of your screen. You can submit questions at any time during the presentation, and we've tried to leave ample time for discussion, and we'll be keeping an eye on all the questions you submit via Q&A. And we'll strive to answer as many as possible at the end. Also, I want to give a special shout out of thanks to the Leo Rangel Endowment for contributing the bulk of financial support for our COVID and incarceration series. Okay, Sharon, take us away.
All right, thank you, Iffy. So welcome to everybody to today's panel. I'm so glad all of you could join us. I want to start by thanking Iffy and Jeremy Levinson and their colleagues at the Geffen School Center for Social Medicine for organizing this event. As Iffy said, I'm Sharon Dalovich. I'm on the Faculty of Law here at UCLA, and since the start of the pandemic, I've been spearheading the UCLA Law COVID-19 Behind Bars data project, which is a proud co-sponsor of today's event. So as Iffy also mentioned, I'll be moderating, and I'll also be starting us off with an overview of the COVID crisis in carceral facilities and the response, or more accurately, the non-response of the federal courts to the crisis nationwide. And just before I begin, I just want to encourage everybody to drop your questions in the chat as they occur to you, and we will do our best to answer them either in the chat or during the Q&A. So as we learned last March, about the nature of this virus and the way that it travels, it was really obvious from the beginning that it would be a particular problem in prisons and jails. And the reason is the conditions under which people live when they are in custody, right? So prisons and jails are generally overcrowded with people crammed into cells or dormitories. Housing units are poorly ventilated. Sanitation is often lacking. People often don't even have the basic means for good hand hygiene. Healthcare is generally abysmal and preventative care is largely non-existent. And as a result, people in prison have a disproportionately high rate of the comorbidities that we early recognize make people especially vulnerable to complications from COVID. And because just being incarcerated is hard on the body, people age faster in prison. So you put all these things together, and what you get is people in prisons and jails who are especially vulnerable to getting infected from COVID and especially vulnerable to getting complications if they are infected. And now, again, we knew this right from the start, right? The terrible living conditions that I've just described were in place in this country long before COVID. And from the start of the pandemic, advocates were sounding the alarm. So what were they saying? They were basically saying, get people out. Because social distancing is key, and because social distancing is impossible in crowded facilities, from the start of the pandemic, advocates, activists, families of incarcerated people themselves were basically calling on prisons and jails to radically decarcerate so they could reduce the population density inside and allow people who remain inside to socially distance. And of course, there was a particular push to get people released who are elderly and or have those medical comorbidities I was talking about. And this would make sense, this particular push to get vulnerable people released, because people who are elderly and or medically compromised are not only especially vulnerable to COVID, but they're also known to have very low rates of recidivism. So, let's just get them out of this dangerous situation. But efforts in this direction sort of immediately ran smack into politics, because the thing is, people who are older and with medical infirmities are also the ones who have typically been in prison the longest, which means the crimes that they committed are likely to have been the most serious. And so what this meant was that people who, from the beginning, we knew were most vulnerable to dying from COVID in prison were also the most politically risky to release. And this is by contrast with jails, actually, which mostly hold people who are either awaiting trial or they're serving time for relatively minor crimes. And because people in jails are there for misdemeanors or pretrial, it's much less politically fraught to release people from jail. And you could actually see this dynamic playing out early in the pandemic. So in the first few months, sort of from March to June, jail populations around the country dropped by about 25%. Still not enough for socially distancing, but significant. While in prisons, the corresponding drop was less than 10%. And much of the drop came from just accelerating the releases of people who were close to their release dates. So we had sort of from last March, this deadly virus, people, quickly spread through airborne particles, people crowded into prisons, large numbers of COVID vulnerable people not being released. So, everybody I think can guess what the result was. What the data showed, even sort of in the summer, was both shocking and in a way totally unsurprising. By early summer, a study that I co-authored, we found that people in state and federal prisons were 5.5 times more likely than people in the US as a whole to have been infected with COVID, and adjusted for age, 3 times more likely to die from the disease. Now, there's a lot you might say about this, but one obvious thing you might ask is, in all of this, where were the courts? Right? In our constitutional scheme, the courts are the ones that are supposed to enforce our Constitution. And under the Constitution, people in prison have an Eighth Amendment right against cruel and unusual punishment. And years ago, the Supreme Court held that prison conditions violate the Eighth Amendment when people in prison are subjected to a known risk of serious harm. So the Eighth Amendment prohibits subjecting people in prison to a known risk of serious harm. Clearly, COVID exposed people in prison to a high risk of serious harm. And by April 2020, every corrections official in the country knew it, right? So you have a constitutional violation on its face. And so then the question is, well, what do you do about it? And if releasing people was the only way to keep people safe, which it is, There's not a lot you can do in a crowded prison with terrible ventilation, for the reasons that I already said, to actually reduce the risk if you keep the level of crowding the same. So if releasing people is the only way to keep people safe, which it is, then those officials who weren't ordering releases were acting unconstitutionally. And this was the argument that the advocates made. So last spring, when all this was getting going, prisoners' advocates were flooding the federal courts around the country filing class actions. And they were arguing that COVID made prison conditions unconstitutional, and that courts should order the prisons to do the one thing we knew would keep people safe, which was to let people out. Now, the federal courts did respond, but the response was not what the plaintiffs and their advocates wanted to hear. Instead, it quickly became clear that if the federal courts were going to intervene, it would be only on the margins, one person at a time, or for very small numbers of people, and only where the courts could act without having to invoke the Constitution. In other words, they avoided entirely making a constitutional finding that would have required appreciable numbers of people to be released. And as a result, over the last year, not one person has been released from a prison or jail through a class action by a federal court on constitutional grounds. So instead, what the courts have effectively said to corrections officials is, whatever happens on your watch during COVID, you don't have to worry about constitutional liability. Now, last spring, before this was clear, there seemed to be some concern on the part of corrections officials, jail and prison officials, that they might be held legally accountable if they didn't act. And that is when we saw the prisoner population drop as a result of actions taken by officials at all levels trying to reduce the population. Not enough, but as I suggested, they did make some progress. But by last summer, officials knew full well that they would face no accountability, pay no price for constitutional violations, at least in the federal courts, regardless of their failure to act, right? The court was not going to make them act. It was not going to hold them liable. So unsurprisingly, at that point, the population reductions that prison officials had begun achieving on their own without court order largely stopped. And then, as I said, when advocates filed class actions with the federal courts saying, well, if public officials are not going to keep doing this and releasing enough people, you have to order the releases. And the federal court said, pretty much go away. Now, there were some contexts in which federal courts did order the releases of vulnerable people, mostly one person at a time, which, by the way, is not great when you have a combined prison and jail population of over 2 million people. But it was something, right? So I want to give the federal courts their due. They did do something. The most significant context was with federal compassionate release. So the idea of compassionate release is that people who are elderly or medically compromised will have an opportunity to make a case for early release, so before their sentence is expired. Now, compassionate release mechanisms are typically very narrow, very tightly held. This is certainly the case for state prisons, from which very few people have been released on compassionate release grounds since the start of the pandemic. But with the federal prisons, it was a little different. In the federal courts, it was a little different. Because in 2018, with the First Step Act, Congress made compassionate release from federal prison easier to get. And this turned out to be very helpful during the pandemic. So the way it works generally is people inside a federal prison will file a request with their warden for compassionate release. If they don't hear back in 30 days, which most don't, then they can go to federal court, and then the federal court can decide. So as of today, almost 3,000 people have been released from federal prison by federal courts on compassionate release grounds. Now, this is still only a small fraction of the more than 150,000 people in federal prison, which doesn't even begin to address the other, 1.9 or so million people in state prisons, but it is still something. Federal courts have also been relatively more willing to grant habeas petitions when they're brought by individual plaintiffs who could show themselves especially vulnerable to COVID. People in immigration detention, ICE detention, had some success there in the federal courts. And in a few cases, I think the last count, I think it's 2 cases, could be a few more, federal judges have ordered federal prison officials to start releasing more people, not on constitutional grounds, but on grounds that the Federal Bureau of Prison Officials were not exercising the expanded authority that Congress gave them under the CARES Act, and that the Attorney General gave them by memo to release more people to home confinement. So the federal court said, look, you have this power, you're not using it, federal prison officials, so start using it. And some releases have been effected that way. They haven't been nothing, but they've been nowhere near enough to stem the threat of COVID in prison. And they've almost entirely focused on the federal prisons, even though the federal courts have the power to enforce the Constitution against state officials. And even though state prisoners make up 90% of all people in US prisons, right, in spite of this, the federal courts have pretty much left state prisons alone during COVID. And this is troubling, right? The way our system is supposed to work, federal courts are supposed to protect people's constitutional right against state abuses. Especially the federal courts are supposed to act when the victims of unconstitutional treatment are the most disenfranchised and politically unpopular members of society, which of course prisoners are. Yet at the moment of this desperate need with lives on the line, the federal courts refused to act to enforce the Constitution. Now, I could give you the legal reasons the court gave for their inaction, but the reasons almost don't matter. Instead, it was just clear from the get-go that the federal courts were determined to stay out of it, and they were going to find a way to stay out of it. And the real question is why? Now, I can only give you a brief answer here. The short version is that the failure of the federal courts to exercise their constitutional authority in this urgent moment was the predictable effect of a long history of federal court inaction in the face of inhumane carceral conditions. Now, there was a brief period in the 1960s and 70s when the federal courts did enforce the Constitution on behalf of people in prison. But since then, over the last 4 or 5 decades, we have seen a deliberate, systematic rollback of the federal court's legal authority to act on prisoners' behalf by enforcing the Constitution. And that is true however brutal the conditions and however great the danger. So really, in a nutshell, what we have seen since March 2020 on this front is the predictable result of a long history of political toleration of inhuman prison conditions and an equally long history of federal court abdication of its responsibility to enforce the Constitution on behalf of people who, because of their incarceration, have been extremely vulnerable to official abuses and extremely likely to have been victims of state abuse. So, I know that this story that I've just told you of political failure, of federal court inaction in the face of real serious risk to life and limb, I get that it's not a happy story. Sorry, my cat wants to get involved here. So not a happy story. But now I want to turn it over to Hadar Aviram, who is going to tell us a somewhat happier story about what happened in the state courts here in California once the federal court opened its doors or closed its doors. Sorry, my cat really wants to participate here. But I'm going to turn it over to Hadar, and you can hear from her some better news.
Thank you, Sharon. Thank you, everybody, for inviting me. It's such an honor to be here, and I'm so delighted that there's lawyers and advocates and activists on our panel, because the strategy to combat COVID-19 in prisons has been basically a joint effort of people from lots of different backgrounds and people who come to this issue with lots of different skill sets and forms of expertise, and that's important to acknowledge. So I think to understand the story of what happened in California in state court, in our case, Von Steich, and in the other habeas corpus cases that are now in Marin County, it's important to start off with something pretty important, and that is, we're not just talking about prisons here. We're talking about an entire web of people who are susceptible to getting this lethal disease. We're talking about people who are on the outside. We're talking about people behind bars in prisons, in county jails, in ICE facilities, in federal prisons. And the reason I think that we have largely failed to protect these folks and the folks on the outside from this disease has been the view that each of these institutions exists in isolation from the other. The idea, for example, that jails are a different jurisdiction, they're, county affairs rather than prisons that are state affairs, and that prisons are closed, so there's no contact between prisons and the outside. And in my work, I call this the myth of carceral impermeability. So the idea that each of these things exists separately. And this is not true. Just geography and epidemiology teach us that there is constant flow of people, of diseases, of germs, of viruses, of stuff between these institutions. Every prison, every jail, even the most maximum security facility that you can imagine, the door is permeable. Every day, hundreds of people come in and out of every facility, every congregate facility in the United States. And I think that this explains to some extent what Sharon pointed out at the beginning is the cause for the problem that we have. So The strategy to address this was both talking about the humanitarian aspect of basically leaving people without treatment. And as Sharon says, this is difficult because there's been this discourse of deservedness that has accompanied the whole conversation about COVID-19 in prisons, this idea that, some people don't deserve healthcare, or, it's a zero-sum game, and trying to address the fact that even people who have been convicted and are serving a sentence were not sentenced to die from medical neglect and from inaction and from ineptitude from a terrible disease behind bars. That's nowhere in the California Penal Code. So that was the first point that was very important to stress. And the other important point was that this is not a zero-sum game. It's not like there's a finite number of people who are going to get sick and die, and it's either going to be them or us for whatever value of them or us is floating about the public. This is an effort that has to be collective, because if people get sick in prisons, prisons become incubators of disease. I'm working now on a book called Fester, a co-authored book, and we've been drawing correlations and noticing that counties that have big prisons or a larger number of correctional facilities within their territory, or counties that closely border them, people are much more likely to get sick. We've drawn correlations between epidemic outbreaks in prisons and epidemic outbreaks on the outside. And the idea is to sort of bring the public and bring the judges around to understanding that this is the point. Now, why did we had some qualified success in state court where federal court has failed? I don't think this is necessarily because state courts are just generally more attentive, or because the Prison Litigation Reform Act, the PLRA, which really binds federal courts, as Sharon explains, from helping incarcerated people when they have lawsuits. I don't think that that's the case. I think a lot of it is just down to the personalities of the judges. And I think a lot of this is because state courts, and especially courts in counties where there's prisons, feel a little bit more responsibility and might feel more territorial. It used to be the case that all prison litigation happened at the federal level. So we pursued habeas corpus writs, and a habeas corpus writ is basically a request to release somebody who is unlawfully detained on behalf of hundreds of people in San Quentin. And this happened as there was a huge outbreak happening in San Quentin. Now, this happened hand in hand with the formation of the Stop San Quentin Outbreak Coalition, which organized a wonderful press conference in front of the prison, and did lots of actions and important things. And at our press conference, we called on the governor to release people. The next day, the governor issued his solution, which was going to be to release no more than 8,000 people. At the time, we had more than 100,000 people in prison, so this was really a drop in the bucket. It would not allow for social distancing. And we had in our back pocket a report from Amend SF, which is an organization of doctors from UCSF and Berkeley who visited inside San Quentin, an antiquated facility with no ventilation, with no solid doors, and said, you have got to bring this prison down to 50% of capacity. Otherwise, you won't be able to properly protect people. At around the time that we were making this advocacy and pushing back on the governor's plan, I was contacted by people representing folks behind bars and invited to come on as a litigant on behalf of the ACLU of Northern California and 17 of my colleagues. And that's what we did. We represented a gentleman by the name of Ivan von Steich, who's been in prison for a very long time, about 40 years, who has a lung issue, still has a bullet lodged in his lung from way back when, before he was incarcerated in the early 80s, and who contracted COVID at the time and was not even separated from his cellmate after he got sick, trying to pursue releases through him. And here's what we learned in the course of this litigation. So let me first tell you what the bottom line was. The bottom line was that in October, where the cases in Quentin had begun to slightly subside after the big June, July, August onslaught of cases, reports came out by the California Inspector General showing that the whole thing has been down to the neglect of the California Department of Corrections and Rehabilitation to prevent a transfer from another prison in Chino that was seeing a huge outbreak to both San Quentin and Corcoran. They basically sent 121 people to these two prisons without properly testing them, without quarantining them, packing them on the bus like sardines, with people reporting symptoms on the bus and medical personnel ignoring them. There are screenshots of the emails to prove that this was known and that they acted nonetheless, and without properly quarantining these people when they arrived. At the same time, the Marin County top health official contacts San Quentin and says, please don't let these people mingle with the rest of the population. They're going to infect everybody, and people in my county in Marin are going to get sick. And the prison adopts this jurisdictional approach and says, you are a county official, we're a state facility, so we don't have to listen to you. And the next thing you know, you have 75% of the population sick. You have the virus ravaging through the prison, killing dozens of people. San Quentin has an older population somewhat than other places. So truly true devastation. And we're trying to push the state courts to intervene as well, given that the governor is not doing anything or not doing, I should say, enough. And eventually in October, we get a decision from the California Court of Appeal that they're ordering San Quentin to shrink its population to 50% of design capacity. But, and here's where we go back to what Sharon said, that there's always this deference to the prisons. They didn't tell them to release people. They told them they could release people or transfer people. And this is an important point, which is that a big part of why the courts can't help people properly is that at every step of the way, the representatives, the legal representatives of the Attorney General's office have been trying to sabotage this. And immediately what they went to was the transfer strategy. Now, at that point, of course, time had elapsed since the height of the pandemic in San Quentin. There were less cases. At the same time, cases were rising throughout the entire system. This is the big November, December wave that many of you probably remember. And when the transfers were supposed to take place, there was not a single prison in the entire state of California that didn't have an active outbreak. So there was nowhere to transfer people to. And yet we're confronting the Attorney General, people telling us, well, you know, you said you wanted transfers. Now you're saying you don't want transfers. So what do you want? Our clients are terrified that they're going to get sick somewhere else. There's also issues of prison politics. People are afraid of being moved to another institution, fears of retaliation, fears of encountering old animosities between facilities. People just were afraid to move and were beginning to pull back their habeas petitions in the hopes to avoid this sort of problem. Meanwhile, the Attorney General ferociously fights us all the way to the California Supreme Court. And the California Supreme Court says you have to give CDCR a chance to provide evidence to show how they try to ameliorate the mistake that they made. Now, this is to us ridiculous because they had an opportunity to do it before the Court of Appeal. They could say, yes, we can socially distance even with more than 50% capacity, or yes, here's what we did, here's how we take care of people. They did not provide a shred of evidence because there is no shred of evidence to provide. And now the case is basically back to the Marin Superior Court, and there's really no point anymore because the tragedy has already happened. So at this point, we already have more than half of the entire California prison population getting sick. So we have almost 50,000 people who got sick. We've already had 221 people die of this disease. Right now, we only have 13 cases. So we're basically already fighting the fight of the next pandemic rather than the fight of this pandemic. And here are some of the lessons, and I'll end with that, some of the lessons that I learned from this litigation. So the first thing that I learned is that this is not, as exactly as Sharon says, this is not about what legal provision does or doesn't help. This is about this general approach of courts to be very conciliatory, very sort of embracing of the correctional culture, very sort of, you know, trying to be nice to everybody, trying to bring in the staff for a conversation. So that's been a very difficult thing to deal with. And I think that regardless of the procedure, this idea that you're going to give the correctional authorities leeway by giving very vague, modest relief is what gives correctional authorities and the legal representatives the ability to circumvent that by coming up with versions of the relief that are worse than if there had been no remedy at all. The third thing that I noticed is that even beyond California, but specifically in California, the problem is the staff. So the staff drag their feet, and there's actual frustration of purpose that happens at that level. Staff that refuse to get tested, staff that refuses to wear masks inside the facility, staff that refuses to get vaccinated and provides basically misinformation to the people in their care. So all of that stuff needs to be taken care of. And all this effort addressed at basically pushing the incarcerated people back into the cells should have been spent on trying to figure out a state mandate to require the staff to get vaccinated. Honestly, A person who does not want to take the vaccine should have no business working at CDCR at this point. Then there's also been the problem of the bottleneck. The fact that the prisons, rather than releasing people, have shut the entrance valve through the jails. That means we now have an adjacent COVID-19 problem happening in the jails, which we know almost nothing about because the counties vary so widely and the sheriffs will not be reporting properly on what's happening in their counties. So that's another thing that's happening. And then we have the issue of the advent of the vaccine, and I'll end with that. And that is that as the vaccine came up, the courts, especially I should say the federal court in Plata versus Newsom, switched tacks. They realized that, they don't want to release people. They're afraid to release people. There's all this concern about political backlash. So what are we going to do instead? We're going to, very gently kind of start convincing rather than making the governor vaccinate everybody behind bars. Let's try and convince them. No mandate to vaccinate behind the jails, in the jails, which is essential, but at least this pressure to vaccinate. Now, on one hand, this is great because it saves more lives. On the other hand, that means that now the advocates, the lawyers, the activists have to adopt two strategies. The short-term strategy is to get everybody vaccinated to put an end to this pandemic. And the long-term is to continue to relentlessly push for releases so that we can prevent the next pandemic. And I'll just end with this. A lot of the conversation has been about deservedness. And because of that, there's all these conversations about, well, should we advocate more forcefully for people who are innocent or for people who are presumed innocent in jail? This is basically buying into this deservedness argument. You shouldn't be mixing deservedness with public health. These are two different issues. The public health issue needs to be addressed because it involves all of us. It involves the health of everybody. And I think that one of the things that was extremely frustrating for us, both at the state level, at the federal level, and with policymakers vis-a-vis the governor's office, has been this idea of trying to combat this fear of public backlash about presumably giving healthcare to people that some members of the public think are undeserving. And I think this is the mentality that we have to fight most ferociously. So I'll end with that. Thank you very much.
Dara, thank you so much. There's such rich comments, and I'm looking forward already to our conversation together. But before that, I'm going to turn it over to Jane Dorotik, who is going to talk to us about her experience and her insights as she's been following the pandemic.
Thank you. Thank you very much for having me. And it's an honor to be here with this esteemed panel. As you heard in the introduction, I was wrongfully convicted in 2001 based on false forensics. I spent most of my time in prison trying to learn about the law. I became a fairly decent jailhouse lawyer, mainly in an effort to help myself and to help my fellow prisoners. When Loyola Law School Project for the Innocent stepped in and found all of the false forensics used to convict me, my conviction was overturned and I was released almost a year ago, right at the beginning of the COVID-19 crisis. I want to tell you first also a little bit about my mindset before experiencing the criminal justice system. I'm ashamed to say now what little energy I put into exploring my viewpoint about the criminal justice system was very, very naive. I honestly thought that these are people that have violated society's norms. Perhaps it's not too harsh to have them behind bars, chopping up rocks. And I see now how very blind I was. I see it in such a greater way as part of a society's problem. You know, also before I jump into my comments about healthcare in the prison system and the court's abilities to direct much of anything inside, I want to just throw out a few statistics that probably a lot of you know of, but gosh, they're worth repeating. Our nation is obsessed with a punitive, retributive reliance on locking people away as a solution to provide public safety. Here in California, we've swayed so far from a goal of public safety as the main criteria for incarceration. We impose lengthy, draconian sentences on the front end, and then on the back end, we never let people out. Whether it's through COVID, whether it's through compassionate release, whether it's through the parole board. I can't tell you the number of women that I know, elderly women that have been in front of the parole board 5, 7, 10 times denied because their ability to articulate the all-important insight and expression of remorse is not up to the commissioner's standards. And somehow society believes keeping all these people in prison forever will keep us safe, when what it really does is siphon funds away from community programs that support and could provide real public safety. California prisons house far too many elderly. More than 1 in 4 today is age 50 or older. 50 is the accepted designation of elderly in prison. Across all of the states, that's the standard, although California still uses age 55, but some of the new elderly parole designate 50. That designation is because people age more rapidly in prison, because of the poor health care, because of the stress. In other words, what that means, if you are biologically 60 years of age, physiologically, you're much closer to 70 to 75 years of age because of that additional stress and the more rapid aging. The cost of keeping all of these elderly, 1 in 4, is roughly $200,000 per year. We know that an average prisoner costs $81,000 a year, an average younger, healthier prisoner. Elderly people cost 2 to 3 times that amount, so $200,000 per prisoner per year. Virtually all the research indicates even those with the highest risk have recidivism rates approaching 0 by the time they reach the age of 40. People just age out of crime. There was another statistic I came across. If we stay on this same trajectory that we're on right now, keeping people, aging people in prison, by the year 2030, the incarceration rate of elderly will have increased by 4,000% higher than it was in 1981. Our country also has more people serving life sentences than were incarcerated in total in 1970. California, again, leads the nation in that. California, over 1 in 3 is serving a life sentence, and that's compared with 1 in 7 nationally. Years of study on the deterrence value of extreme sentences have shown that these sentences do not deter crime, nor do they promote public safety. The humanitarian costs of keeping individuals behind bars decades after they have rehabilitated themselves is unethical, and it violates human rights. The cost to families and communities is borne to an unconscionable degree by communities of color. Also, the alarming rate of increase of incarceration of women completely devastates families for generations to come. And lest we forget, 66% of incarcerated women are single parents of dependent children. And those children now must be either tracked or cared for by the state. 80% of women in prison report being victims of abuse before they were incarcerated and then became victims of state violence. California also leads the nation in imposing LWOP sentences. LWOP is life without the possibility of parole or death by incarceration. In California, we have almost 5,200 people serving that sentence. More than half had no prior criminal history. 80% are people of color. The average age of imposing that sentence is 19. So those are just incredible statistics. And I always want to say, how did we as a society get here? How did we allow this to happen? That mass incarceration is the solution to everything. The $13 billion a year that California spends on the prison system is not making us safer. So the ability of the courts to fix the crisis of prison health care. Almost every improvement in prison health care has been as a result of a lawsuit, usually filed by the prison law office and settled prior to trial. However, even with an agreed upon settlement or solution, the prison law office has to come back in time after time to make the prisons adhere to the agreed upon improvement. I think prison healthcare staff have become much better at creating a paper trail. In other words, documenting that appears to indicate constitutionally adequate care. But this doesn't always equate to improved care. I'll give you just a little example. One of the things I learned the hard way behind bars. All of the prison system uses a documentation or charting method called SOAP charting, subjective, objective, assessment, and plan. So all of their chart notes follow that format. And I was horrified at one point when I obtained my medical records, which I learned early on to do quickly. I might walk into the doctor and say, gosh, doctor, I have a terrible back pain. I've had this pain for 3 days. I don't know what the doctor's writing down in the notes. The doctor then should make their observation. Prisoner is bent over in pain. Assessment, back pain, plan, get an MRI, provide physical therapy, provide some pain medication, whatever the plan is. I became horrified to realize what was being written. Sometimes nothing that I said, to the point where I began to say, doctor, I would like you to document under subjective, this is what I'm telling you. I'm telling you my back is in terrible pain, or whatever the solution was. Another example of the prison system's unwillingness to actually improve care, but to give the perception of improved care. When the prison law office comes back into a particular prison to evaluate care, of course, they evaluate that care by reviewing the records, looking at that SOAP charting note. And they often ask to speak with individual prisoners. What often happens is, and this has specifically happened to me, I'll be called down with a little ducat, a little prison appointment slip. You'll be meeting with the prison law office down in the correctional treatment center, the medical facility, and your appointment is at 10 o'clock, be there. So I would arrive at 10 o'clock and the staff would say, oh, the prison law office is tied up with something else. I'm sure you don't want to wait. We'll tell them that you declined the interview. And I would say, no, thank you. I don't mind waiting. I will stay here and wait. Well, no, they're not, do you really want to do that? They won't mind if you. So the prison system itself goes way out of their way to make sure that people who want to tell what's going on have a difficult time making that meeting, or they'll give you a ducat to a different appointment site intentionally sometimes, and just make it really difficult. In this COVID crisis that we're finally beginning to put behind us, the prison system is always, always behind. As I said, I was released at the beginning of the COVID crisis. Those of us inside knew that, by the media, knew that this was a huge crisis. We knew that people in the community were wearing masks. We knew that we had no masks. We knew that elderly were much more vulnerable. We started on our own in the housing unit that I lived in. We started on our own, taking scrap materials that we had, making our own masks and handing them out first to the elderly and then to the entire unit. What happened is that women wearing masks were often challenged by the guards, by the correctional officers. You can't wear that mask. That could be considered escape paraphernalia. So take that mask off. And of course, we would say, we need the mask to protect ourselves and each other from this crisis. But many people were told to take the mask off. I also remember a particular woman feeling unwell, walking up to the health clinic, asking to have her temperature taken because, of course, she was afraid she might have been exposed, might be coming down with COVID-19 or anything. She walks into the clinic without an appointment, asks to have her temperature taken. She's sent away twice. No, wait for an appointment. Get out of here. You don't have. She finally came and asked me, and because I was part of the Women's Advisory Council, because I was part of the Golden Girl, the elderly organization, I was able to walk back with her, and I had some fairly decent rapport with some of the medical staff. I was able to get her temperature taken. But that's just kind of an example. Everybody knows we have a crisis going on here. All of the prison mentality is we need to do something about this crisis, whether it's the mentality on the part of the prisoners themselves or the staff. We know it's a crisis. We have someone here who wants to have their temperature taken. Can't you just do it? So there's always those obstructions. Professor mentioned transfers of people from the CIM, California Institution for men up to San Quentin. At the same time, or shortly before those transfers occurred, we knew that finally the prison system had been directed to create masks. For whatever reason, the staff between CIM and CIW were going back and forth, whether it was lay staff or guards. We knew they went back and forth because staff would tell us, oh, I was over at CIM yesterday. Yeah, they've got it much worse. And yet the prison system, knowing the risks with the huge number of people already testing positive at CIM, would not stop the transfers. In fact, they simply said, no, we don't trade staff back and forth. That's not happening. When we knew it was. They also transferred material over and required women in the PIA, Prison Industrial Association, I forget what we called it. Well, internally we called it a sweat factory. It was the sewing arm. They were then required to create masks, and we knew the material coming over from CIM, where the rate was so high, material was brought over by an on masks, on gloved staff. Who knows who touched it? The women at CIW who were making these masks were not given any kind of protection or gloves to wear, and then the masks were finally handed out to replace the little handmade masks we had all made. So there are so many ways here that the prison system does not pay attention to what the risks are, especially for an outbreak like COVID-19. I'm just very grateful that I was able to get out and, before I came down with it, and also very sad for the women that I've left behind. I do know that the vaccination rate at CIW is better. I know that a vaccination has been offered to everyone who wants it now at CIW. So that's one positive, but as somebody mentioned previously, that takes away all of the need on the part of the CDCR, the corrections organization, to actually release people. As others have noted, it's impossible to provide social distancing in the prison system when you live in a 70 square foot cell with another inmate, and that cell is your kitchen, living room, bathroom, etc. Everybody has to walk down the hall to communal showers. The likelihood of infecting each other is huge, huge. So yes, the courts have done an abysmal job at helping with this. And with that, I'll stop and pass it over to my peer.
Jane, thank you so much. Your voice and perspective are so important, and I'm really grateful to you. I just learned so much listening to you. And I know everyone else did too. I'm going to turn it over to our last panelist, James King from the Ella Baker Center. So James, over to you.
Good morning. Thanks for inviting me to speak with you today, and for all of the insightful and thoughtful comments that have gone before me. I'd like to begin by detailing some of the conditions I observed during my 15+ years of incarceration. Then I'll give an analysis of recent litigation in California addressing health concerns for incarcerated people, and close with thoughts on how to affect realistic, sustainable change in our current criminal legal system. Rasan Thomas, a friend of mine who is still currently incarcerated, said of the outbreak that occurred at San Quentin last year that it wasn't COVID that killed his friends and peers, it was overcrowding. His comment reflects the fact that our nation's over-reliance upon incarceration as a means of dealing with societal ills has long had severe health consequences for many people who are incarcerated. And as Hadar pointed out, the prisons surrounding communities as well. The function of prison is to warehouse people. The basic design, hundreds of cells, narrow tiers and hallways so that people are funneled to their destinations. A shower area, phone area, day room, one entrance, one exit to the building. Anything more than that is considered a security risk. Once outside of the building, what is commonly called the yard typically consists of a patch of dirt, often only a few hundred square feet, 4 to 5 benches, maybe a pull-up bar or two, or maybe not. In California, walking around some of the newer prisons, one gets the impression that prison administrators knew that the building boom of the 80s and 90s would not be limitless. And so they made arrangements to pack the space as tightly and efficiently as possible. Each prison has thousands of small, cramped cells, far fewer showers, phones, or recreational spaces. These spaces were designed to house people. And since the boom occurred during the tough on crime era, politically, it was unfeasible to create many amenities for the people they are designed to hold. Even so, in the early 2000s, 2 incarcerated people successfully sued the California Department of Corrections and Rehabilitation, and the court decided that the severe overcrowding and CDCR's inability to provide basic medical care for the people in their custody constituted cruel and unusual punishment and violated the constitutional rights of incarcerated people. The courts then ordered the population be capped at 137.5% of design capacity. And that's where it currently stands now. The recent history of litigation dealing with people's health in California prisons is a mixed bag, however. A few years after the ruling I mentioned above, several incarcerated people who were held in Central Valley prisons sued CDCR after contracting a virus known as valley fever. Many medical experts agreed that the grounds the prisons were built upon were not fit for human habitation due to the fungus that caused valley fever. CDCR successfully resisted legal efforts to close those prisons, however. And in fact, those prisons are still operational to this day. As an organizer who is willing to explore every potential means of reducing incarceration rates as a response to public health and public safety, I've become convinced that litigation is often the avenue most likely to have unintended consequences. In fact, a recent Office of the Inspector General report regarding last year's San Quentin outbreak suggests that the transfer that caused the outbreak there was itself an unintended consequence of a legal hearing of the case I referenced at the very beginning of my remarks. The concept of court rulings as a means to shape policy is deeply flawed and often causes as much harm as positive effect. In California, judges have recently seemed to be reluctant to issue rulings, instead relying upon case management hearings to try to improve conditions. At these hearings, both petitioner and respondent often put forward contradicting facts, and judges appear reluctant to challenge these contradictions. At the same time, theoretically, our courts are supposed to be the most immune to external political pressures that make decarceration so politically unfeasible for most politicians. Our courts, however, have proven themselves to be no more immune to political pressure than the most brazen politicians. Imagine, for instance, if what occurred in San Quentin happened in a nursing home. San Quentin refused offers of free PPE and testing. They packed over 100 people into unventilated buses and drove them for hours from their original prison to San Quentin. Several were showing overt symptoms of COVID-19. Medical staff at both prisons sent urgent emails expressing concerns about the transfer, which San Quentin only found out about on the day it happened. Ultimately, over 2,000 people became infected in a matter of weeks, and dozens of people died. Almost a year later, the incarceration rate at that prison and in our nation remains largely unchanged. Can you imagine this happening to anyone other than incarcerated people? Our political systems are not serving the needs of the most vulnerable and marginalized people in our communities. It takes public sentiment to create political climate, to change political climates. In order to create change, I'd ask you to follow abolitionists on social media. Click like on everything and anything critiquing the legal system. Go to rallies and protests. Educate yourself on bills that reduce the number of people incarcerated, then call your local legislators and advocate for the bills. Ask your friends and family to do so as well. We make it an issue, the media and the politicians will respond. We, the people, have to make the status quo uncomfortable. The more people who become active and engaged in the democratic process and do the work of activating and engaging others, the more successful we will be. Right now, today, I would argue that we are still in the tough on crime era of criminal justice that began in the late 80s. I do believe we can turn the page, finally, if we're willing to participate in our democracy more actively and make it happen. Thank you.
James, thank you so much. And thank you to all of our panelists. I'm going to invite all our panelists to turn their videos on for the conversation we're about to have. Before we turn to, there's some questions that have been raised in the chat that I know people are keen to answer. Before we get there, I just wanted to ask, I have questions, for each of you, and I want to start with you, James. I know that you've been really involved in organizing both inside and outside to try to challenge the status quo and change the system. And I'm curious if you could talk to us a bit about the role of incarcerated advocates and activists and how you've seen people on the inside trying to get public attention to this issue, try to make change from inside. And first of all, what you've seen on that front, and second of all, what people like us who are not inside could do to support incarcerated activists and advocates.
Thank you. When the outbreak occurred last March, when the pandemic began, prior to that, San Quentin was a fairly unique prison within the state of California in that hundreds of outside community members went into and out of the prison daily. In fact, San Quentin, as a prison itself, has a local chapter of the Society of Professional Journalists, and there were organizers and activists who were going in and had built relationships with incarcerated people for years prior to the pandemic and the shelter in place. And thus, when the outbreak occurred, we were largely ready. The lines of communication were open. And I think that one of the most vital takeaways is when it comes to organizing and when it comes to affecting change, you want to build the relationships prior. You want to have real, consistent, sustainable relationships so that when it's time to mobilize, to rally, the relationships and the trust is already there. That's what we were fortunate to have in the San Quentin community, where directly, currently incarcerated people were, they were the first to tell us what the conditions were within the state prison and what they felt would keep them safe. Our role on the outside as loved ones and friends of those who are inside was simply to amplify it and create space. I believe that one of and when I say amplify it and create space, when and where the opportunity presented itself, we wanted the currently incarcerated person to advocate for themselves. So if a reporter contacted me and asked about the conditions, I would forward them to one of my friends inside in every instance that I could, because even myself as a formerly incarcerated person, I have a different set of challenges and I'm marginalized in a different way than people who are currently system impacted. So creating a space, using whatever privileges and opportunities were coming our way to channel them towards people who are currently incarcerated was a guiding principle for us in our organizing. And it really gave us a North Star in how to, what to advocate for that people inside were asking for that would keep them safe. So I would say, first and foremost, it starts with building relationships with people who are currently incarcerated. Second, equally important, is a willingness to take direction from them and to share privilege with them. Like it's all too often, we have the enormous power out here to be gatekeepers. And you want your gate to be wide open, and everyone that comes your way, you want to send them to people inside to advocate for themselves. In doing so, it's my belief that the advocacy that occurred last year was of a different texture as a result of people advocating for themselves. One other thing that I would add to it is this advocacy that people are doing for themselves and we're doing for themselves last year is not neutral. And what I mean by that is the legal system sees people advocating for themselves as a threat to the safety and security of the institution. We did, at every point, every step along the way, had to be mindful that we were not putting people in danger of risking their potential freedom. That being said, we made the decision that people inside know what's best for themselves, and we would honor their autonomy and agency. We made it a goal to say that prison treats people differently. They other people. To the best of our ability, we would resist those inclinations within ourselves. I'll pause my answer there.
Yeah, that's really helpful and insightful. And it also just, Hadar just reminded me, and I was wanting to mention too, that as James says, to kind of hear from, understand what people are going on inside, and letting people who are inside kind of be the ones to define their own experience. So vital. And there's a project right now that's being undertaken at the university, at UC Irvine, led by Karamet Ryder and many of her students in the criminology department, where they are inviting people who are currently incarcerated in California prisons to share their experiences during COVID. The project is called Prison Pandemic, and the website is just Prison Pandemic, all one word, .uci.edu, and they've got recordings and transcriptions of many hundreds, as right now even, and they're still collecting hundreds of testimonials to sort of, if you're interested, to go and fill out some of the details of the kinds of things that James has been talking about. I actually, the question, Philippe raised this question that it was actually a version of what I was going to ask Jane. And so I wanted to put this question both to Jane and to James. I was thinking, especially in terms of what Jane was describing about interactions with staff, and how rather than actually doing the job of trying to make the prison safer for everyone, what you experienced was staff trying to undermine safety and frame it as a security risk, when actually what they were doing was the opposite. And I was interested in, and Philippe asked a question like this too, which is to hear more about your personal experiences, both negative and positive, because I'm wondering if it was sort of all one way, if it felt to you while you were inside, all one way in terms of the way the staff interacted with you, or if there were positive experiences, both staff and clinicians, and whether you saw any impact, again, I guess positive or negative, of the way staff behaved with respect to how courts were acting. Because Jane, you said that you felt like sometimes court intervention did more harm than good. And I'm wondering if you saw some of that play out in real time. So just to put it in a short version, sort of positive and negative experiences with staff, and what impact, if any, positive or negative, you think court intervention might have on the way staff behave towards incarcerated people. So Jane, I'll ask you first, and then I'll turn it back to James. Oh, I think you're still on mute, Jane. The dangers of Zoom.
Yes, yeah, the dangers of Zoom. Thank you for that question. And definitely the interactions with staff were a mixed bag, although for the most part, leaning on the negative side. I can remember particular staff, one in general, who was the housing correctional officer in the unit that I lived in. When people would walk out for meals, he would stand there with hand sanitizer and give everyone a squirt who wanted it. And he wore a mask consistently, but he was rare. The other side was definitely staff not wearing masks, even after the mandate had come out very clearly that all staff were to wear masks. They just wouldn't. And I'm talking about high level captains, associate wardens, who just refused. And that made everything really difficult, because we were all critically aware of where the danger came from. We're an isolated community. It depends on who comes in and who brings things in. And so that made life very difficult for us.
Yeah, thank you. I'm glad, I am happy to hear your account of a positive experience with correctional staff, just to remind us all that there is a range, although as you say, unfortunately tends to the negative. James, thoughts?
No, I agree with Jane completely. I think the thing that I would add to that is, for much of last year, maybe even to this day, masks themselves became a political issue. And prison staff was not immune to that. And from my experience, prison employees tend to come from a more conservative law enforcement background. And as Jane says, it's not a monolithic, they're not homogenous, but the vast majority is borne out in the statistics that right now, over 80% of currently incarcerated people who have been offered the vaccine have accepted the vaccine. The vaccination acceptance rates for guards are actually much, much lower. In addition, guards are conditioned from the very first day of their training to see incarcerated people as security threats. And so, and to other incarcerated people as a means to desensitize themselves to continue to keep them in captivity. You cannot really fully acknowledge a person's humanity and lock them in a cage night after night, year after year, especially many of the elderly people that Jane was mentioning and highlighting earlier. So years of conditioning of seeing incarcerated people as somehow less than human has also played a very important role in how the guards have responded to helping the facilitate safety for people inside. And I'll close with one anecdote that I heard firsthand from a very high official in California Department of Corrections and Rehabilitation. She told a story to me and a couple of family members of people who are currently incarcerated. She said that she went and toured a prison, and when she got there, people didn't recognize her role in CDCR, and she asked them, how was the pandemic? How were they dealing? And she said they all said, "Oh, we're okay, we're safe. Thank you for asking." She said by the time she got to the end of the building, people had realized who she actually was and what her larger role was. And now they were crying out that it wasn't safe and they were in danger. She told us that story as a way of kind of like attempting to undermine people's healthcare concerns. So the qualitative data that people that infection rates were 5 times more likely inside, and that people were 2.5 more times more likely to die, played no role in her anecdote. What was more important was her perpetuating that narrative that incarcerated people are somehow devious and will try anything in order to affect their own freedom and release. I'll close there.
Yeah, wow, thank you for that. Hadar,
Sharon,
yes,
I'm
please.
sorry, Sharon, can I jump in for a minute? I really appreciate James's comments. And, I'll just add also, the domineering culture within the prison system is something that is so pervasive. And what happens for staff who try and do fairly decent things and see people in a more humane way, they get labeled as inmate lovers and they become ostracized from their peer group. As James has said, it's a more conservative, more domineering group that attracts people to the career choice of becoming a guard. And so many of the guards, at a annual starting salary of $71,000 and the requirement being only a high school diploma or a GED, it's a very attractive field for many young men. And you put that together with perhaps an excess of testosterone and wanting to dominate, it colors people. And they're very much a closed group, and they're not at all accepting to people who step outside their line of thinking.
Thank you. It is a scary thing to think that this is the institution we have created, where we take vulnerable people, put them behind bars, say you can't act on your own behalf, you can't defend yourself, and then we put people in the vein that you've just described, with all the power over them and high walls to hide everything. It's a recipe for abuse. So I don't know, Hadar, I don't know if I'm sure you have thoughts just on the conversation we just had. I wanted to invite you to share them, and then I had a question for you, but I'll let you respond first.
Sure. So I've been following up and reporting on what's been going on in my blog, and I have a blog post that's been pretty popular. It's called "The Staff is the Problem," and that basically tells you everything about the post. What has been really upsetting to me is how late the prison guards union has been to step up to the table. And I think a lot of this is, we know that the prison guards union in California is an extremely powerful political player, and we know that they expend their social and political capital in the direction of locking up more people. So just in the last election, we voted on 3 very, very punitive criminal justice propositions, all of which lost. But the prison guards union invested $4 million in supporting those propositions instead of telling their members to wear masks. So my fear is that this is a case of complete political political capture, and the union doesn't actually support the rational interests of their members. And we have to remember that staff has gotten sick, staff has died in this disease, and nonetheless, there was precious little to kind of try to combat whatever, COVID denialism narratives were going around. We heard from people inside that assistant wardens were telling them that they were not going to get vaccinated because COVID was a hoax. And this has been incredibly difficult. And it's been very hard to tell whether the problem is at the top, it's at the leadership that sort of awoke very late into joining the Plata versus Newsom litigation, or whether this is just COVID denialism among the rank and file because of exactly what James and Jane have just described. And because of that, every time there's a case management conference in the Plata case, where everybody's saying, well, what are we going to do? What are we going to do? I don't know. Why are the guards doing it? There is not a single study that I could find about support for Trump, about political opinions of prison guards. So all we're doing here is hypothesizing based on what we know. This has not been thoroughly studied. And because of that, they're stymied as to how to get them into action. I will say that the key in procuring the very high vaccine response rate, and I think the first people to be congratulated for this are the incarcerated people themselves, because it is so challenging to get information via CDCR channels that you can trust. And there are layers upon layers of an incredibly painful history of medical experimentation. Until just a few years ago, women were being sterilized without consent in California facilities. So we were very worried that people understandably would not trust the vaccine. And initially we were talking to people and they were saying, look, I don't know, even if the guard takes the vaccine in front of me, who's to say that the same liquid they're taking in is the same liquid they're going to offer me? And I think it's to the credit of activists, and for the most part, people who had been just recently incarcerated and still have a lot of friends on the inside, that stepped up, sent me videos, sent videos to Amend, helped Amend create their own document of frequently asked questions about the vaccine, providing people with information from sources that they could trust 100%, that were not mediated by the staff or by CDCR, whose credibility was very problematic.
Yeah, I mean, I second all of that. And I will just say, just a data point, a study that we published in the American Journal of Preventive Medicine, we found that staff are infected at 3.2 times the rate of the general population. So still less than incarcerated people, but it's significant, and you would think that would lead to advocacy. So I just want to just say a couple of things. One of these comments was raised in the chat, and I just wanted to echo it. If we think that federal courts could, in theory, have a role, the problem we face is not only the long history of federal court inaction and hostility even to the suits of incarcerated people, notwithstanding that brief reform era I mentioned, but also we have the reality that now a full quarter of the federal judiciary was appointed by President Trump. And those people are generally, the people he appointed are generally hostile to, civil rights, to class actions, to the rights of incarcerated people, you name it, which makes it even more challenging to try to think about how to make system-wide change when you have literally no branch of government that is affirmatively taking on the challenge. And one of the Bailey Wexler raised a question in the chat, a sort of two-parter. One of the part is what prompted the rollback of federal court abilities to protect prisoners, and on that one, it's such a huge topic that I want to put it to one side. And Bailey, happy to have that conversation with you, because I want us to sort of think in a more proactive way about what we could do going forward. So Bailey also asks, what institutions are generally pushing against the phenomenon of judicial inactivity? And Hadar, I wondered if you could start us off sort of talking about, so in a way, sort of resistance to federal court inaction, but just a kind of more proactive strategy. What would be the thing, where in civil society do you see the potential for change? What combination of advocacy initiatives, social movements do you see as carrying the potential to actually make an appreciable difference to the set of really pernicious dynamics that we have been talking about?
So this is where maybe I'm going to be more positive. I failed to be positive at the beginning. I was I promised to say optimistic things.
Falsely. I said right.
So this is where maybe I have some optimism to offer. And this is based on the work that I've done in conjunction with the Stop San Quentin Coalition. And I think that one of the wonderful things about the coalition is that in this, and I say this because I've had so many experiences in criminal justice advocacy. I've been doing this for 20 years. And I think that this has been the most successful coalition that I've ever been a member of, because it involves people who come from lots of different constituencies, lots of different backgrounds, lots of different skill sets, and everybody is coming together to save lives, which I think is incredibly effective and important. We tend, I think, especially in the left, when we advocate for these topics, to have a lot of hair-splitting differences between organizations, and then we start fighting each other and we stop sort of remembering how to tell friend from foe. And I think one of the amazing things about the coalition is that people have, for the most part, have been on the same page, and everybody used their own skill set to advocate and push forward. If I have to sort of look back, and James, who's been a hugely influential member of the coalition, can probably chime in as well. If I have to think about what was sort of our crowning achievement in the stuff that we've done so far, I think it's been pushing proper information inside so that people can make knowledgeable decisions, informed decisions about getting vaccinated. And I think it's been alerting the public to what's going on. I mean, one of the things that gives me hope now, for example, is the new nomination for Attorney General. Rob Bonta, who's going to be the next Attorney General in California, was on stage with us, with James and with me and with Adnan Khan and a series of other people at the gates of San Quentin, at the height of the epidemic, talking to Gavin Newsom and saying, please let people go. And to me, this is already a herald of victory, that we've gotten so much public attention to this, that now there is a person that we know, personally knows what has happened here and was aware of the atrocity, the human rights atrocity that happened here, and is going to take this office forward. The reason why this is important is because if the judiciary is turning more conservative, which of course is true, not that I think this is going to make a humongous difference, because they were already extremely hostile to claims from prisons for various reasons that you can find in the works of Sharon and many others. But because their sort of vague relief offers and stuff like that is so easily manipulated by prison authorities and their representatives at the Attorney General offices. And I think because of that, it's important to get on board people who understand that these are human beings. And if people are going to be very legalistic about it, which, you know, the Attorney General office is, it's important to drive home again and again and again the fact that nowhere in the California Penal Code does it say that the punishment for any offense, including first-degree murder, is to die of a terrible disease and to have medical neglect and cruelty pushed at you. This, I think, is a legalistic method that people get behind. The other thing that is crucially important, and I think this is something that we can go through with judges, and I saw this in the von Steitch case, is truly bringing to bear the fact that you have to understand not only how prisons work, but also how science works. That if you're trying to create healthcare changes, you have to drive home the fact that the prisons are not closed within themselves. This is something that I think we could and should make progress on in terms of jail vaccination. Because if all counties in California are not going to aggressively offer vaccination on an ongoing basis to the jail population, which by its very nature is more transient, people often spend, because people can spend any time between a few days and a few years in jail, and people can cycle out. What an amazing opportunity when you look at it for a public health intervention, for reaching a huge swath of the population, inoculating them, thus also saving the prison population from a reinfection from people coming in from jail, right? What an amazing opportunity. But in order to avail ourselves from this opportunity, we would have to convince local county lawmakers and judges that this pandemic is not a zero-sum game, that if people inside get sick, people outside get sick. We have the regression models to prove this. This is true. This is true. All it takes is for somebody who is carrying this virus to leave the prison, to go home after their shift and get takeout on the way home. Boom, you could have a county epidemic. You don't even have to understand a lot about prison and carceral culture. You just have to know how a virus works. And to drive home to even to people who find it hard to extend compassion to people that are not exactly like them. And of course, we have to remember that there's a class component to this, there's a racial component to this, there's all kinds of things that play into this narrative of deservedness. And just to drive home the fact that when you protect your fellow human beings who are behind bars, you are also protecting you and your family. And I think that both judges and lawmakers should and can be amenable to that if the point is made in a solid way. I think we are making headway, not as fast as we would want, but again, we know that this problem did not start with COVID-19. It's always been difficult.
Yes.
To.
So I was just going to say, to put the courts in the picture. I mean, Hadar is painting a really powerful picture of collaboration across constituencies. Societally, and for people sort of to not wait for government actors to decide for themselves, but actually to push the change forward. I just want to emphasize how I see the courts relating, which is, judges are human beings too, and they're also in society. And they are also as susceptible to prejudice and as open to rethinking as anybody else. And so I actually see the role of civil society and public education as in part changing the political narrative so that political actors will see things differently, take actions that they might not have otherwise taken, but also as a way to influence judges. So as I see it, courts play a really powerful role. Lawyers play a powerful role. They're fact finders. They get inside locked facilities and they can actually get access to information and then share it more broadly. And courts, when they decide to exercise their power, actually can have a considerable amount of power. So I see this as a kind of collective effort to change the narrative for everyone so that every actor, including the courts, can use whatever power they have. And it just turns out courts are very powerful. So if we push judges in ways that challenge dominant narratives and make them start recognizing the urgency of the issues that Hadar and James and Jane have been talking about, that in itself will make a huge difference on the legal side.
This is a really good point.
Oh, sorry, Hadar.
I just want to piggyback on what you've just said. This idea that the courts already have power and what they need is an encouragement to step into their power. What I see in a lot of the meetings in Plata versus Newsom, and I've been attending every case management conference, is I hear from the judge saying, look, I don't want to be giving orders. Why the hell not? You're a judge. That's your job. It's your job to tell people what to do. Step into it, embrace it. That is what you do. It's like this idea that for almost a year we've been treading water because of this kind of peaceful conciliatory effort to get people together, but they're not getting together. You're a judge. You are the responsible adult in the room.
Yeah, let me bring James in because I think he wants to comment on this too.
Yeah, I just want to say that like I have a different view of the courts. I completely agree with the power that they have, but from my personal experience, when I first entered into the California prison system, population levels were near, if not above, 200%. And I think it was in 2008 that the Plata-Coleman rulings, 9th District Federal Court of Appeals, capped the population rates at 137.5%. Governor Brown at that time then championed and ultimately signed AB 109, which took thousands of people, if not tens of thousands of people who had been in California state prisons and instead housed them in city and county jails. In fact, right now, currently, CDCR has been boasting for the last year that they have maybe about 10,000 fewer people in prison. And we also know that there are 10,000 increased people in county jails waiting to go to prison. As a result of the Plata-Coleman ruling, capping the population at 137.5%, which is in my opinion, one of the most successful pieces of legislation that I saw during my time in prison. The only thing that changed is where people were incarcerated. And county jails are much worse to be incarcerated in, particularly for long-term, for long periods of time than prisons are. So I just want to say that the courts do have the power to affect the change, and they are great as narrative building places, to build and shape narratives around incarceration rate. But they're nowhere near educated enough to come out with the type of comprehensive rulings needed to actually decarcerate. And until we get to that level, and one final point that I would make, I think that Hadar is absolutely right when she says that our advocacy in San Quentin Stop San Quentin Outbreak Coalition was very key in the vaccination rates or vaccinations going inside, in that it became such a political problem that it was in the governor's best interest to offer vaccines inside. California is one of the few states that has prioritized offering vaccinations to currently incarcerated people. My personal view of incarcerated people themselves is, for instance, when I was in prison, and I'm sure Jane can speak to this as well, people in prison have access to media. Like, we watch the news all of the time. When you're locked in a cell 23, 24 hours a day, and you're going through COVID-19, you're very well informed about it. And so people had access to usually more information than I did about the actual solutions. But it was the pressure we put out there that made the governor prioritize offering vaccines inside that I thought was key and crucial.
Yeah, I'm just looking at the clock. Just a few closing thoughts I just wanted to offer quickly. One is, I really hear what James was saying, that one successful court order is never going to do it. It's not that we ever finish the conversation, finish the effort. It's that you make one change that goes in the right direction, and you have to keep pushing on all fronts, I think, and bringing together all the different constituencies to engage. I also just wanted to say, somebody mentioned something in the chat about alternatives to vaccination. And I think it's important to recognize that vaccination is one crucial strategy we now have. But as Hadar said, we have to keep pushing for decarceration, to protect people today, to prevent against the next pandemic. And I also really think, I said some of this in the Q&A answered in the chat, that right now people have been in lockdown for a year. I mean, people around the country, not just in California, in prisons have been no movement, no family visits, no programming. And there's a mental health crisis and just a sense of trauma that people are experiencing daily. And I think we all need to collectively start thinking about how to take care of people inside beyond just keeping them safe from COVID. And that also, I think, will involve all stakeholders. And the other thing I'll just say, a question was raised that unfortunately we're not going to have time to vet, but I want to just lift it up. The question is, how do we push against what Hadar was calling the culture of undeservingness, that I think the biggest problem is that all the people with power in society don't see incarcerated people as human beings. Jane spoke to this, James spoke to this. And I think if the collective enterprise is going to make a difference with all constituencies, advocates, activists, courts, politicians, we just have to collectively start recognizing that people in prison are human beings. They are not away from society. As Jane was saying, they're actually part of society. And we have to think collectively with everyone involved about how we're going to make healthier institutions for society, and prisons being a key societal institution. So I'm so sorry, so many great comments were raised in the chat, and I know we only had time to address a few of them, but unfortunately we're out of time. I really want to thank James and Jane and Hadar for your wonderful participation, and Jeremy and Ippy and Philippe and the team at the Geffen School Center for Social Medicine. Oh, wait, I'm told, I thought we had to end. Ippy, do we have more time? Oh my God. For people, I hope you're not leaving yet. We have a half an hour. We can talk about the things that I just talked about. I am so sorry. That's actually great news. So if that's true, yay, thank you. I hope we don't lose you people. I would like to actually turn it to the panel to talk about this culture of undeservingness, which is something I really wanted us to get to. So I don't know, James, Jane, Hadar, if you want to speak to this question about how you think we can strategize pushing back on the idea that people in prison are other, and institutions, and prison is not an institution in society that affects everyone. What strategies do you think would be most effective? Hadar, if you want to start us off.
Sure, maybe I can start. I think that one key thing that we can all do, and I think this is what we're doing right now, is that every public conversation about this stuff has to include people who are either currently incarcerated or who have been incarcerated. One very sad truth about incarceration in America is that almost 1 in 100 Americans is incarcerated, but it's not evenly spread across the population. So there are some communities that experience a lot more incarceration and currently just are familiar, personally know friends, relatives, neighbors who are in prison or who have been in prison. And there are some populations that hardly have any contact with incarcerated people. And just to drive the idea that there is intelligence and wisdom, and there are articulate people who know what the problems are and who can contribute to them is enormous. Just last month, we held a conference, which we hosted at Hastings, about the COVID-19 crisis in prisons. And one of our panelists, Jose Armendariz, chimed in from inside the Orange County jail, with a camera, which I will tell you requires, as James and Jane know better than anybody, requires an enormous amount of courage, because you're not supposed to, obviously film jail and participate in a conference, and just basically let us see firsthand with an extremely elaborate and lucid commentary about what precisely was going to happen and what was happening at the time behind bars. I think that for a lot of our attendees, this was their first exposure to somebody who is right now speaking to them from behind bars. This is, we in these advocacy circles, thankfully, have this wisdom of interacting everybody together. So there's not this paternalistic view of people on the outside who don't know what prison is like from the inside, but rather that the need comes from the people who best know what is important to them and what they need, right? I think that there are a lot of people in this country who have not had a conversation with somebody who is currently in prison. And this is one of the reasons why I think that cutting down phones and not letting people have tablets and all of that is so counterproductive, both to people's reentry because of our dependence on all this technology when people come out, but also to the fact that we have to be exposed to the fact that our friends and neighbors and fellow citizens are incarcerated, and they are like us. They are human beings, and they have opinions and views and thoughts about how to improve the situation. This was one of the key things that was, at least for me, wonderful about working in the coalition. And I think we should make it a point that every conference that we have about any issue involving congregate facilities has to have not kind of we will allow a token person from a facility to talk, but it has to be a genuine partnership. Because the insights really come from the people who are at the front lines of suffering.
Just a few quick things to respond, and then I would love to hear on this from James and Jane. What Hadar just said about not allowing phones, tablets, emails is counterproductive, but it makes me think about, Jane, what you said, Jane, about the way staff are trying to keep you from talking to advocates. And I don't know if it's it depends on what your mission is, right? If your mission is to keep the walls high, to keep people inside silence and hidden in a black box, it makes perfect sense not to give them phone access and tablet access. And so I think, it should be a collective political pressure to allow greater permeability. And Hadar, I know you've been writing about this extensively, greater permeability. And so I just want to remind everybody on that theme about Karamet Writers' UCI prison pandemic site, where you can actually hear directly the voices of people who are currently inside and experiencing COVID firsthand. And, early in the pandemic, some of you may have seen there was a video that was smuggled out of an Ohio prison. I think it was Elkton, where a young incarcerated person managed to get a hold of a cell phone, and then he took video of himself and his cellmates who were in respiratory distress. And you could see what it was like to be having COVID inside, locked in a small cell. And I think that actually had a big impact on public understanding. It had tons of views. So James and Jane, I wanted to see if you would weigh in on this question of how to challenge the culture of deservingness. And I want to raise a question that was suggested in the chat by Ernie Vasquez on this theme, which asked if you could talk about parole success for older people released from prison, because maybe getting clearer on low recidivism for this population would help us understand what needs to be done.
Yeah, thank you. I mean, it's a great question and it's a great challenge. I absolutely believe in what we've all said, that you have to involve all stakeholders. Whenever you're trying to make any kind of transition within society, whatever it is, all stakeholders need to be involved. I also think it's really, really important to tell personal stories. It's another way of humanizing people who are inside. I know I was, I was guilty of it before I became aware of what the criminal justice system was all about. I didn't think about it. I put it aside and thought, maybe this is what we have to do for public safety. And it's not at all. When I look at women that I know inside who, perhaps grew up in an alcoholic abusive family, were put out on the streets at age 12 or 13 with a pimp. And then by age 18, some terrible something happened. Perhaps with the man that they were with, perhaps who knows what, but now they're in prison. Whose fault is that? I mean, when does society start taking some responsibility for allowing these things to happen? And when are we going to start funding communities to be able to provide some support so that locking people up is not always the answer? I'm a firm believer in decarcerating. And one of the ways that I think we could decarcerate quickly and easily, and I was way more hopeful that it could go in that direction when COVID started. You talked about elderly parole and the success rate of elderly. We have almost 30,000 elderly in the California prison system. Many of them there, virtually almost all of them there for a long period of time with a life sentence. So they go in front of the parole board. Repeatedly, they're denied parole. They're denied parole at an almost 10% lower rate than the average prisoner. And why is that? When we know that they're the safest population to release, they're the most expensive to continue to incarcerate, they have the lowest recidivism rate, why are we not releasing these people? And that's a question you would have to ask the commissioners themselves. But I know so many women who have been in front of the parole board 5, 7, 10 times and denied parole over and over again. And it's just absolutely ridiculous. It's something that really, really needs to change within the system. If you go on the BPH website and look at their parole success rate, they're going to give you an overall figure of less than 20%, but that's because of the way that they measure. They measure their success rate based on scheduled parole hearings. And in fact, they cancel or the prisoner cancels about 40% of those. So if we were being really accurate statisticians, we would measure it on the actual parole hearings that took place. So if you do it that way, and while I was inside, I was able to get a lot of those reports and figure it out. And that's how I became aware that the elderly success rate is fully 10% below all other parole success rates. And that makes absolutely no sense at all. So, there are some simple ways. 30,000 at a cost of 200 per prisoner per year. If we release just 80% of those, the state would be saving almost $5 billion with a B, almost $5 billion. And that's a simple solution. All of the research in the last 20 years says this is the safest population to release. So I don't know why we're not taking those steps. I don't know why there's not more pressure on the commissioners to increase their release rate. We have elderly parole programs, but statistically, it's just not happening. And to me, that's a huge problem.
James.
Yeah, I agree with everything Hadar and Jane and you as well, Sharon, have named it. And I would just say that I've been really, law enforcement has cultivated an aura of integrity for decades. And I've been really pleased to see it starting to splinter over the last several years, because I think that none of our institutions have the luxury of being above critique. And so just the fact that we are just now starting to move into a space where we are not taking a person at face value because they wear a law enforcement uniform or have a title, I think is very healthy for our society. I think that I remember, I think it was 2015 or 2016, there was an outbreak of Legionnaires at San Quentin State Prison. And as was common for journalism at that time, the journalist who wrote about the story spoke to the prison spokesperson, who then gave them a statement and never once talked to anyone who was incarcerated within the prison. So this story about people who were living here with this outbreak occurring never actually talked to anyone who was going through the outbreak itself. So last year, I was very pleased to see Megan Cassidy and Jason Fagoni from the San Francisco Chronicle do actual reporting, develop contacts and relationships with people who are currently incarcerated, and included in their reporting so that their reporting was actually more comprehensive. I don't believe in objective reporting as a thing, but it was comprehensive because it was actually talking to all of the stakeholders that you, Sharon, mentioned earlier. So I think that when we talk about this culture of deservedness, it's very key that we have every stakeholder out and able to speak for themselves. One other thing that I would add to that, though, is I think it's human nature, and science has shown that it's human nature, that we tend to like status quo. So it's much easier to stay out of prison if you're out of prison. It's also much easier to stay in prison. Like, it's the safer decision to keep a person in prison. And right now, our system is designed to say, well, should we let you out? And when that's the default, most people, including commissioners, are going to say the safest decision is to leave things as they are. So it's not just the culture of undeservedness that we have to mitigate. We also have to mitigate these systems which are designed to facilitate the current status quo. We need to develop systems that recognize that scientific data suggests that people age out of crime. We know statistically that you are much less likely to commit harmful acts age 45 and up. So yeah, those things have proven to have much more impact and effect than anything rehabilitative or otherwise that our prison systems have been doing. It's simply the fact that once a person reaches a certain age, they gain more impulse control, they gain more tools to process trauma and harm in their lives, and they make healthier and better decisions. So we need systems in place to say, well, if that's the case, then this is going to be the outcome, and make that the default, as opposed to our current systems, which facilitate leaving things as they are as the easiest outcome.
Yeah, I was going to say that one of the things that I hope comes out of this awful COVID situation is that over the past year, for the first time in my memory, reporters want to know not just how many people are in prison and how many people are getting out, but also what are the conditions like for the people who live inside. And I want to encourage everyone on this call to tell everyone in your lives as much as you can about what the daily life is like for people in custody, especially during COVID, because, you know, the conditions that I mentioned at the beginning, that Hadar talked about, that James and Jane have talked about, this is the daily reality for people. And the more we can recognize that they are having basically an experience of you know, some kind of torture, the equivalent of mass solitary confinement, I think the better able we'll be to get people to see and relate to people as human beings. I wanted to change the conversation in a direction that a number of the questions went in. Just, you know, so this event is a combined effort of the Geffen School Center for Social Medicine and the UCLA Law COVID-19 Behind Bars Data Project. And it suggests that there is some positive benefit to bringing together the medical profession and the legal profession to try to think about how we address the broad sweep of issues that we've been talking about, not just COVID, but all the other public health harms that are done by incarceration to people inside, to people in the community. And I guess I wanted to invite you all to talk about how you see the relationship, what role do you see positive view for lawyers and for psychiatrists. You know, people talked a lot in the chat about mental health provision and medical staff. how those constituencies could begin to respond. And by contrast, you know, I think some people were saying in the chat that a lot of the major professional organizations, American Psychiatric Association, for example, they're very good at writing letters, you know, decrying conditions, and less good at mobilizing their members to actually make a meaningful difference on the ground. So I'm curious to know your thoughts about the role of medical professionals, mental health professionals, and lawyers in collectively responding to this set of issues. And I'll invite any one of you to start us off.
Maybe specifically because I'm assuming that on this call, there's a lot of people from UCLA Medical School and maybe from other medical schools. I will say that one of the shining stars and some of the true heroes of the struggle have been AMEND, which is an organization of doctors at UCSF and UC Berkeley. And I think a lot of this is in the sense that they've defined medicine in a broad way, that a correctional culture that is sick is also in need of medicine. So AMEND is stepping in ways that are much broader than just COVID-19. They have a project where they collaborate with Norwegian prison officials to bring in some of the Scandinavian prison culture into California. They've created a very successful partnership about it that is great. They have some world-class gerontologists on the scene, which are very well versed in the issues about aging people that we've just discussed. A huge problem coming into parole and a huge problem in general, just because the conditions are so bad. And they were key players actually in the von Steichen case. It's the von Steichen case to a great degree relied on their finding when they visited St. Quentin that you cannot actually socially distance people within the facility unless there were physically less people in the facility. And also the fact that I think that medical professionals are especially attuned to the need to distinguish between medical treatment and all kinds of other things that belong sort of in the world of deservedness. Let me give you an example. Sharon, you just mentioned solitary confinement. In the early days of the pandemic, when the numbers just started alarmingly rising in St. Quentin, one of the things that the AMEND team found out on the ground in early June was that they were isolating people in solitary confinement cells. They were using cells that people for decades had recognized and equated with the worst form of punishment that can be, and they used it for medical isolation. You can't do that. Just from a public health standpoint, it's crazy. Nobody's going to want to report symptoms. Nobody's want to get tested because they want to avoid a consequence that they are very familiar with and that is horrible to them. So a lot of these observations are observations. I mean, of course, I'm assuming that many of our listeners and viewers are thinking, well, yeah, that's just common sense. But you'll agree that doctors are uniquely qualified to make that argument, to say, if what you want is really to isolate people for medical reasons, you have to separate that from anything else. I mean, we're experiencing a lot of these mixing of deservedness language with public health language in a lot of aspects of this pandemic and health in prison in general. But I think that coming from the doctors, it was especially forceful and especially convincing. Of course, that then led to all kinds of complications, like building tent in the yard during the horrible fires of the summer. I mean, we've been through, it's just, I don't know how you all feel, but I feel like it's been 20 years since all of this started, because there's just been things happening like almost every day. But the doctors were uniquely qualified to say something. We've seen the folks from White Coats for Black Lives coming to coalition meetings. We have a public health committee within the coalition that has done really important work, not just in terms of vaccine advocacy, although that's part of it, but a lot of other things. So these are a lot of ways in which doctors can contribute. I will also say, and I realize that this is a difficult consideration, we've heard, especially from people who are law enforcement people in rural counties, that it's very difficult to recruit quality medical personnel to move in there and work there. And this is partly why they don't have enough high quality doctors and nurses and other medical healthcare staff to actually treat people that need treatment. This is a huge problem. And of course, a lot of it is compensation and all kinds of other issues. But going into the market, this is a place where if you think or hope to do something of value and offer help where it is most needed, to consider making your career in a correctional setting would be such a huge boon to humanity. So think of that too. The need is just so great.
You know, on that point in particular, and just to speak to the question of how various social society and professional institutions can come together, I actually have long hoped to see doctors in training doing rotations in correctional medicine. as a standard part of the rotation. And I actually think the UC system would, the UC medical schools would be a good place to make that happen. You know, we have so many prisons in California. We don't have enough doctors. We've been struggling to get enough doctors and other medical professionals on the ground in the facilities. And doctors in training will go abroad to do, you know, developmental medicine, or they'll go to other underserved communities in the country. And I would like us to start thinking about correctional health as an appropriate place for staff to do training, and urgent training. And so, Jane, I wonder if you could speak a little about the role you see for mental health professionals. Being a number of people have raised in the chat issues about mental health treatment. And I wonder if you have thoughts about the way mental health professionals could take a different and more engaged role in all that we've been talking about.
Yeah, absolutely. And thank you. It's a great question. And I do have a lot of strong feelings about the mental health staff. Again, some of which who are really quite good, many of whom are not. You probably are all aware CIW had a very serious suicide crisis several years ago and had the highest rate of suicide in the California prison system. Because of that, we created a program inside called Compassionate Companions, which not only was able to support people who were terminal, who were dying, and provide a vigil, and that took a huge amount of effort, but we were able to get it through and provide that vigil. We also attempted to provide intervention when someone was in a suicidal crisis. I need to first explain what happens when you're in a suicidal crisis in the prison system. If I were to go to staff and say to them, gosh, I'm having a terrible time, I've been here for these amount of years, I'm desperate, I'm thinking of hurting myself, the first thing that would happen to me is I would be handcuffed. Then I would be paraded across the yard, taken to the mental health crisis bed, examined by a medical practitioner. And of course, everyone on the yard is going to be watching me being paraded across the yard. Oh, what did Jane do? Why is that happening? I would be put in this isolation cell. I would be stripped of all of my clothing, all of everything. I will be given a suicide blanket to hold around myself. And then there'll be a staff outside my door looking at me through a window with a clipboard, making little notes about what I do or don't do. So when you know that, what woman in her right mind is going to go to staff and say, now I'm feeling like harming myself? So that was one of the reasons for creating the Compassionate Companions program. This is something we brought up with mental health staff through the women's advocacy group inside. Unfortunately, it didn't go anywhere. The answer was always security trumps everything. And even the guards walking with someone in handcuffs across the yard, they take their baton out and carry it at their side. I mean, it's just so humiliating and dehumanizing. And why do we have to do things this way when we know, when I brought it up in the medical staff meetings with the Women's Advisory Council, medical staff would jump in and say, well, that's not how it's done in the community. Why are we doing this? Good question. Why are we doing it? And why do we continue to do it? Because it's just exacerbating the suicide crisis. So in many ways, I would like to see mental health staff take a much more active role. Even little things like, again, at CIW, there was a mental health clinic that people could make appointments and go and talk about their worries, their concerns. But it wasn't a walk-in clinic, so somebody who was in an immediate crisis, the gatekeeper to that clinic was custody staff. And so how are they going to get in? And then we had many examples of women in crisis going to that clinic, being tossed back out. Ask your staff to put in a copay. We'll see you in a couple of days. You know, put your crisis on hold. And it just is so dehumanizing. And then we wonder why we have these kinds of crises. I want to back up for a minute also and talk, you know, we were talking about the parole board. And I also want to just mention all of the parole commissioners are appointed by the governor. And they are also required to sit in front of a legislative body every year who looks at their rate, who looks at their legitimacy as a commissioner. And who's very present at those annual legislative reviews? The Guards Union supports the crime victims groups, and they're the ones who track carefully. Oh, Commissioner Anderson we see your rate is now exceeding 38%. Don't you think that's a little high? And that kind of level, why are we allowing this? Why are we having this and putting so much energy into that kind of a system? I believe very strongly in victims, but I believe very strongly in a restorative justice approach to resolving anything, not to simply say, you know, it's the crime victims against the perpetrators or the perceived perpetrators. We can't continue to think that way if we hope to ever solve anything. So I just wanted to throw that in, that that's part of the motivation for the parole commissioners maintaining the status quo. It's not just their own status quo in the prison system, it's potentially their career livelihood. They could be not reconfirmed through that legislative committee simply because their rates are getting a little high. And there's something very wrong with that.
You know, I feel like the theme of what I'm hearing from so many of you, or all of you, is that the things that happen in the prison are so toxic and counterproductive, and that the constituents on the outside just need to know more, right? We somehow need to, I mean, what you're describing about parole should be a concern to everybody in the state, because everybody has an interest in having a healthy, appropriately designed and run parole system. And you know what you're describing about the experience of having a mental health crisis in the prison, I feel like, again, mental health organizations in the state should be training their members to understand what happens in this really central social institution, and then try to think about how the professional organization can actually take steps. We just have another minute or two. I wonder if any of you have closing thoughts on how to bring the courts along in all of this. You know, we started by talking about the way the federal courts in particular have seemed to abandon the Constitution. And yet we know that courts have a real power to act if they choose to act. And maybe I don't know if we can answer this question now, but I guess I put on the table the question of what we can all do collectively to try to encourage courts to use the power that they have in a socially productive way. So I don't know if Hadar, you closing thoughts on that question?
Keep pressing on in all directions, on the legislature and administration, on, you know, just expanding knowledge of what's going on. The change has to happen organically everywhere. Like James says, judges are people. They're just like everybody else. We have got to change the conversation, and that's going to push things forward in the courts as well.
Thank you. James.
Yeah, I just would continue to stress that courts are political institutions, and we know that political power works the same no matter what the system and institution is. So it's important that we create the political climate that will make it the safe and easy decision for our judges and for other stakeholders to work to get on the side of decarceration. I think that the more people who engage in the entire process, the more it will create a space where people, where it becomes easier for judges to make very reasonable rulings.
Ippy, I'm going to turn it over to you.
Great. Well, thank you all so much for, in some ways, heartbreaking, but really inspiring session. Thanks, Jane and James, especially for sharing your experiences in your work, and Sharon and Hadar for your professional expertise. And you know, the audience, thank you guys for all those questions and comments. I feel like we really had a great discussion. And remember, we're just kicking off what we hope will be an ongoing discussion over the next couple months. So please do join us at our next panel, and I'm trying to, here we go, which is going to be May 8th, Saturday, 10 to noon. And the topic's going to be healthcare inside and out, and we'll be focusing even more on clinical issues and healthcare. So be able to sort of really follow some of these questions that came up today up. So please join us again then. Again, thank you to all of our panelists, and thanks everyone, and hope to see you all next month.